All right, to this now, around 94 girls in the Eastern Cape, in the Eastern Cape, are believed to have had kids and given birth between the age of 10 and 14. This is in April, and it's believed to have happened in health facilities. And this is according to some reports, of course, accrediting the health department on this and saying that around 3,961 girls and women between the ages of 15 and 19 have given birth. This is during the same period. And of course, it's quite a significant number and speaks to the deepening crisis of teenage pregnancy in the country, especially when you look at what has been said over time and how some of the numbers are looking. Let's have a discussion now. We speak to Eastern Cape Health MEC ThandokaziCapa, who's joining us live now. Thank you so much, MEC, for your time. And certainly, one gets disturbed when you see such reports and you get to see such statistics, and certainly it must be worrying for you. So let's begin then with the numbers and the ages of these girls. Are they correct?
Yes, they are correct. Good afternoon, Bungiwe. The numbers are correct. They are very accurate because we get them from our facilities.
And you must be devastated because these are numbers that, no parent really wants to see increase, or even, just to see a 10-year-old giving birth. There's all sorts of complexities.
Definitely, it's really worrisome for the department. Hence, as the department, we've decided that we are going to have a drive so that we visit high schools, we visit areas where we can see that the numbers are rising. I think a week ago, we went to a school in Dabankulu where we picked up as the department that the numbers were very high. We decided to visit that school. We're doing an awareness, and we also brought our mobile services where we were engaging young people. But we want to call out to the communities because as the department, we cannot deal with this alone. It needs everybody. It needs community members. It needs traditional leaders, church leaders. It needs everybody because it's a societal matter, but it is really worrying us as a department.
Speaking about this being a societal matter, of course, there's a number of concerns that arise from that, and I'm going to get to them in just a moment. But is it not a problem in some of these cases where society is silent about predators, older men who are preying on young girls and simply not getting arrested?
Definitely, it is worrying. But one thing we said as a department, let's first get a thorough research on this issue because we don't want to assume that the 10-year-old are sleeping with the older men. But it must be a report that a thorough research has been done. We are going to embark on that as a department. But when I visited the school that I'm talking about in Dabankulu, one issue when I was engaging the teachers there was the fact that when we put an implant to our girls, parents will advise children not to do it because they are saying they're not going to get children, even if they want to after they get married or when they are ready to have kids. They're not going to be able to do that. So though there are such situations, there are such beliefs that we must be able to deal with. Hence, we are saying we must begin to engage communities, encourage parents to talk to their children about issues of sex. Because, in communities, especially the Black communities, it is not something that is easily done to engage your children about these matters. So it is important, therefore, that we must begin to educate communities, educate parents to be open, engage their children about these issues. Otherwise, it's not going to be easy for the department to deal with because they come to us whilst they are already pregnant. But we are trying our level best. That is why we have developed a program which is called an integrated school health program. We also have youth zones. We've already established about 513 across the province in trying to make sure that our young girls and the boys are able to go to areas where they are comfortable and they meet with the young nurses so that they are able to engage, because sometimes it will be difficult for a child or to go and engage somebody of my age, or maybe in a situation where when you get into that clinic, you find that it's your mother's friend or it's your neighbor, then it makes it difficult for them to engage on such issues. Hence, we are saying, let's get young people so that they are able to talk to them.
And you speak about something very important. And of course, the reason why we even talk about predators, for example, is that there are activists who talk about how this happens. And I hope that your research is finalized as quickly as possible so you get to the bottom of it. But let me go to something you've just said. How do you begin to change the mindset of a parent who believes that speaking to their child about such issues is actually going to get them stimulated, and they're now going to then want to engage in sexual activity and thus believing that it's not yet time? So where do you begin to change these mindsets? Because as you say, you're really faced with a mammoth battle there.
It's a huge one, and it's not going to be easy. But I think if we engage and continuously convince them to understand that whether you discuss this matter or not, but our young kids are beginning to get this information outside. We are living in a fourth industry now, period, where young people are able to get information even on the internet and other things. Therefore, it is important that we engage the elders to understand that it is high time that we begin to engage on these discussions. Otherwise, it's becoming a crisis. Remember, if you do not talk about it, somebody else is going to engage about this outside. But it is better if you are doing this as a parent. At least you are able to talk to your child. You are able to introduce things that you think, if you engage on this at an early age, these are the disadvantages. It is better when it's said by you rather than it is said by someone else. I know it's going to be difficult because you have to change the mindset, but we must try, and we'll keep on trying.
MEC, there's something I want to pick your brain on before I let you go. So when you go and visit them in these schools, where are they saying they're getting this information from that they might not be able to have kids should they decide to, either take the pill or put any other form of preventative measure?
The school that I visited, because remember, I'm new in the department, the school that I visited, most of the young girls that were there, that I spoke with, were not aware of this information. That is why I think we need to have a drive as the department, so that we educate, we make sure it is available. But what we picked up was the fact that it's a lack of access to the information, which is key, that I think we must drive as a department.
Yeah, lack of access to information, and it's very important, as you say, also change mindsets as well, because it's not just the department that must deal with this. This is a societal problem that must be dealt with by everyone. So thank you so much, MEC, for getting us started on this conversation, and hopefully your drive gets to bear some fruit. That was Eastern Cape Health MEC there, ThandokaziCapa.